Well, this is our home monitor that can be used by patients at home to manage their own chronic disease. It has, for example, a number of instruments attached to it. It has a spirometer for doing your lung function. It has a pulse oximeter for measuring how much oxygen there is in your blood. It has an ECG electrodes to record your ECG to pick up cardiac abnormalities. It has a very sophisticated blood pressure device that listens for your heartbeat, very much like your doctor does. We have a very simple way of monitoring, of course, your body temperature, and we can measure your weight very accurately to 50-gram accuracy. And on top of that, of course, we can also ask you questions and help to remind you to take your medications.
Well, give us an example, Branko. Show us. Take some of your take your temperature, or test your lungs for us, please.
Well, testing the lungs is very simply. I just go and select spirometry, which is lung function analysis. The system then launches this particular application. I say take measurement. You have the history there that you can see as well. It now asks me to take that measurements. It will beep at me. Then I put this in my mouth, take a very deep breath. This measurement tells me how much air I blew out and how rapidly. It's a very important measure of lung function that all the clinicians know how to interpret. So that's a very important measurement. It asked me to do it 3 times. I won't this particular time. I can also do my ECG. That's a very important measurement, not normally able to be taken at home. Again, I very simply press the ECG button. I pressed the wrong button then. I go to measurements, and it asks me to do ECG. I select ECG, I take the measurement now, take measurements, and then all I need to do is put my hands around these electrodes. And I'm recording a good quality ECG at home without gels, without cables, without anything. And if there were clinicians around, they would see that my ECG is a little bit abnormal. I have a bundle branch block. Very easy. Anyone can do this.
And keeping people in their homes for longer.
Absolutely. And of course there's other aspects to this as well. There's a full audio-visual video conferencing facility, so you can contact your carer and they can contact you and ask you questions. There is a complete questionnaire system. There's also a medication management system, and you can also send messages back to your carer, setting up an appointment or asking some question for them. There's a very simple email system, and it's all done without a keyboard, so people don't need to worry about typing, which most elderly folk cannot do and do not want to do. So as I said, the other options that you have here are things like messaging, questionnaires and health diary. I can go to messaging, and this will remind me of something. It says, please schedule a video conference. I can create a new message, and my message will be to my carer, my nurse, Barbara Stevens. And I want to have that person check my measurements because I'm a bit worried about them. At this point here, what priority do I give this? I'll give it a high priority because I'm really worried. And at this point here, I just simply send. Or I could add more text with my finger.
And then you wait for Barbara Stevens to get in contact with you.
Barbara Stevens will either call me up or set up a video conference, and I'll be able to speak to her via the video conferencing system if I need to. But of course the objective here is not to have too many communications because they're complex and they require time to organise. She has full available data on my condition and can look at it historically and see whether my trends are good or bad. And she also has available to an expert system that helps her to identify all the patients who are either stable, those that are showing early adverse trends, and those that are showing worrying acute trends that may land them in hospital unless they're managed carefully almost immediately. So it's a full end-to-end management system for managing chronic disease at home.